Hello, and welcome to Celiac.com News. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. Exploring the power of expectation in gluten challenges for chronic pain patients, this study explores how our expectations, more than gluten itself, can influence symptoms in people with chronic pain conditions like fibromyalgia, irritable bowel syndrome, and chronic headaches. By using open-label placebos, pills that participants were told contained no active ingredients, researchers looked at whether mindset alone could reduce pain or digestive discomfort during a gluten challenge. The results suggest that in conditions like fibromyalgia, the brain's role in pain may be more powerful than we once thought. Many people with chronic pain turn to special diets, such as gluten-free eating, to find relief. While many report improvements, the scientific evidence is mixed. Researchers designed this study to better understand whether reported symptoms are truly caused by gluten or shaped by what people believe gluten will do to them. Fibromyalgia was the primary focus, since it's a condition where pain is common, but no clear physical cause is usually found. Food is often blamed as a trigger. The study included 26 participants, most with fibromyalgia, some with irritable bowel syndrome, or chronic headaches. Each person consumed porridge that either did or did not contain gluten without knowing which version they received. They also took an open-label placebo, which means they were told the pill had no active ingredients. But the way this was explained varied. Some people got neutral instructions, simply stating what the pill was. Others received positive instructions, which explained that even though the pill was inactive, it might still help reduce pain or discomfort. Researchers then measured how much pain or digestive upset participants experienced after the challenge. What did they find? Among fibromyalgia patients, those who got the positive message about the placebo experienced less pain, even if they ate gluten. On the other hand, those given neutral instructions reported more pain after the meal. This suggests that belief in a treatment, even one that's inactive, can strongly affect how pain is experienced. The connection between what people expected and what they felt was clear. Those who believed the pill would help were more likely to feel relief. Interestingly, these placebo effects didn't apply to digestive symptoms. People still experienced some indigestion, whether they had eaten real gluten or not, and regardless of the type of instruction they were given. This means the open-label placebo helped with pain, but not with digestion. Another important finding: whether the porridge contained real gluten or not didn't change outcomes. Pain and indigestion were not significantly different between those who had gluten and those who didn't. This suggests that for some people, the idea of gluten might be more powerful than the gluten itself. That's known as a nocebo effect, where expecting harm causes symptoms, even if the harmful substance isn't really there. Looking more closely at the different chronic pain groups, fibromyalgia patients were the most responsive to the placebo instructions. This makes sense, since fibromyalgia is known to be highly influenced by psychological and emotional factors. People with irritable bowel syndrome showed smaller changes, perhaps because not all of them had pain at the time of testing. And while all the headache patients did experience reduced pain, the group was too small to draw firm conclusions. So, what does all of this mean for people with celiac disease or those who suspect they're gluten sensitive? While this study didn't involve people with diagnosed celiac disease, it may still offer insight. Many people believe they are sensitive to gluten even if medical tests don't confirm it. This study suggests that in such cases, the expectation of harm may be contributing to their symptoms, especially when it comes to pain. It's important to stress that this does not apply to people with confirmed celiac disease. For them, gluten really does cause damage to the small intestine, and strict gluten avoidance is non-negotiable. But for those without celiac disease who feel worse after eating gluten, this study raises the possibility that the brain's expectations are playing a larger role than previously thought. This research also adds to growing evidence that open-label placebos can help even when people know they're placebos. That makes them an ethical and potentially helpful option in chronic pain management. And how the placebo is presented matters. Participants who received positive instructions felt better than those who received neutral ones. This highlights how much the communication between patients and healthcare providers can influence outcomes. In the end, this study shifts some of the focus from gluten to the power of the mind. For people with fibromyalgia or other chronic pain conditions, the belief that gluten causes symptoms might actually be contributing to those symptoms. Positive expectations, especially when introduced thoughtfully, were enough to reduce pain, even during a gluten challenge. Of course, none of this means that symptoms are all in someone's head. Pain and discomfort are very real. But this research encourages a more holistic view, one that includes psychological factors like belief, expectation, and mindset. For people navigating gluten sensitivity without a celiac diagnosis, the brain may be just as important to consider as the diet itself. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in, and see you next time.